Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist, I have provided very important topics in a very systematic order, so you can make use of it. Thank you very much. In the last class, we are discussing about the clinical aspects related to the doshas. So today we will see one more important thing, guna, that is sneha guna. So when we talk about sneha guna is present in pitta, pittam sasneha, isn't it? Pittam sasneha tikshnoshnam, whereas sneha guna is also present in kapha. Okay, stiratva, snigdhatva. So sneha guna is there. Now, how to differentiate clinically whenever there is increase in the sneha guna in the body, whether it is because of the pitta or whether it is because of a kapha. Okay, so increase of sneha guna due to the vitiation of the pitta, okay, will be always associated with the pitta features, pittaja features. What are the other pittaja features? For example, hot feeling, lightness of the body, okay, or some typical varnas in the body, color changes, neither shukla or nor aruna varna, along with other pittaja symptoms. So that means if the sneha guna of the pitta is increasing in the body, now we will have other pittaja symptoms associated with that. Whereas if the sneha guna of the kapha is increasing in the body, then it is usually associated with the other kaphaja symptoms. Okay, sneha is increased along with the shaitya, sneha is increased along with the gurutva, sneha is increased along with the body color changing to white or stool color become white, along with other kaphaja symptoms. Okay, now the question comes, pittam sasneha, isn't it? In the shloka we will say pittam sasneha tikshnoshnam. What is the meaning of this pittam sasneha? Okay, so that means pittam sasneha means pitta is the one which aids the agni in doing the normal function. Okay, that means sneha is present in the pitta, and because of that sneha, it helps for the agni function, agni deepti. In homa and havanas, usually we will offer the grita, sneha, to the homa. So that is to ignite the fire, So here also, along with pitta, sneha is there, and purpose of sneha there is to ignite the fire, to increase the digestive capacity, to increase the metabolism. Okay, but if this sneha become excess, it leads to Agnimandya, no doubt. If the sneha is less, then also it leads to Agnimandya. Got the point? If the sneha is less, then also it leads to Agnimandya, because that particular sneha itself is igniting the fire, just like in homa and havana. Okay, similarly, this particular sneha, if it is less, then also there will be Agnimandya in the body. This particular sneha, if it is more, then also there is Agnimandya in the body. So therefore, one thing. Second thing is sneha guna present in pitta, so that is the one actually which give varna to the pitta. Okay, so pitta yellowish color or whatever the color is there, so that particular color sneha guna brings the varna to the pitta. So this is the reason in case of kamala. Okay, so in case of kamala we will have abnormal color, maybe in the sclera, in the skin or tongue or nails, etc. So excess pitatva is there. That excess pitatva is because of increased pitta. Okay, dagda pittam, in the Pandu and Kamala the words comes dagda pittam, etc. So excess pitta is burning the bodily tissues, because of which that color comes. So sneha word in relation to pitta has got two important meaning. Okay, now sneha which is present in the kapha. If you say sneha which is present in the kapha, now purely sneha present in kapha, so that is a nutrition source. Okay, it is for the nutrition of the body. What we nowadays say in contemporary science, fat, etc., lipids, fat, etc. But sneha which is present in pitta is not lipid or fat, etc. It is the one which is actually igniting. Okay, so therefore these two things should be very, very carefully understood. Similarly, we will have another important word, that is kleda. Okay, kleda. Kleda will be seen in both pitta and as well as kapha. Kapha also there is kleda is there. In pitta also there will be kleda is there. Pittaja kleda because of pitta, it is due to excess ushnatva. Okay, So Ushna can lead to Drava Shosha and also leads to Dravatva. So Ushna guna, that is hot quality, so it may lead to Drava Shosha also, and the same it may also lead to Dravatva also, Ushna. Now if it is Snigdha Ushna, okay, if it is Snigdha Ushna, then Dravatva increases. If it is Ruksha Ushna, then Drava Shosha occurs. Okay, Drava Shosha occurs. For example, Ushna Snigdha, Dravatva will go into increase, just like in case of Masha. Whereas Ruksha Ushna, it is Ushna, but it is Ruksha. So then Drava Shosha will be there. Drava Shosha will be there. Best example is Jiraka. So Jiraka causes Drava Shosha. Now Kleda, so this is Kleda which is present in Pitta. Okay, so when Pitta is associated with the Kleda, actually it is because of excess Ushna, and this Ushna may lead to Drava Shosha and also Drava increase. When increase in the Dravatva, that is called as Kledatva. Okay, the Ruksha Ushna, okay, that causes Drava Shosha, first one, whereas Snigdha Ushna, so that will cause Dravatva or Kledatva will be increased. Therefore, after Masha, the Kledatva will increases. Now, Kleda in relation to Kapha. In Kapha also there is Kledatva is there. Okay, so again there are two things are there. One is Drava Kleda and Sandra Kleda. Okay, Drava Kleda means it is absorbable circulatory form. Drava Kleda means that Kleda, Lasika, Kleda, so that is present in the circulatory form. Okay, Sandra Kleda means it is non-absorbable form. Now, non-absorbable form. Okay, that means Drava Kleda means it is present in the circulatory system. It can be absorbed back into the circulation. Okay, so somewhere it may get collected and then it again get collected back into the circulatory system. Sandra Kleda is not that. It cannot be again get back into the circulation. Sandra Kleda cannot be absorbed. The best example is Drava Kleda. So this type of things will be seen in so many Shota-like conditions, etc. Whereas Sandra Kleda condition will be seen in case of Prameha. Prameha, it is non-absorbable form. Another is Vata Vriddhi also leads to Rukshata, isn't it? But similarly, Kapha Kshaya also leads to Rukshata. So how to understand? Rukshata is there now, body. Is it because of Kapha Vriddhi, Vata Vriddhi, or is it because of Kapha Kshaya? So this point we have to understand. So here also the differentiation is required. So what classic says in such conditions is look at the other symptoms. Look at the other symptoms means if Rukshata is there because of Vata Vriddhi, try to find out other Vataja symptoms. If the Rukshata is there because of Kapha Kshaya, try to find out other Kapha Kshaya symptoms. Okay, so Kshaya of the particular dosha is evidenced by either reduction of its own guna or production of the opposite gunas of its nature. Okay, now this is also important. Kshaya of a particular dosha is evidenced by the reduction of its own guna. This part we have already discussed. Kshinaha Jhati Swalingam. Okay, so own guna, or there may be production of the opposite gunas of its nature. In Vata we are told that Vata's normal function is Uksaha. The opposite guna of the Uksaha is Vishada. So Vata Kshaya may lead to Vishada. So Karmana Prakrita Hani Vruddhanapi Virodhinam. So dosha prakriti vaishamyat nityam vriddhi lakshanam. So in certain conditions of dosha kshaya, the original gunas of the doshas exist along with the production of the opposite symptoms. So usually I told that whenever there is dosha kshaya, the normal functions of the doshas will be lost and exactly opposite to that will be produced. But there are certain conditions where dosha kshaya will be there. Although there is dosha kshaya, the original gunas of the doshas will be retained, but there is also production of, but definitely there is production of the opposite gunas. मतलब उसका जो अपना गुण है उसको रिटेन करते हुए उस अपना गुण का ऑपोजिट लक्षण भी वहां पे प्रोड्यूस होता है. Now Vata is basically Shita Ruksha, while Kapha is because of Shita Snigdha. Agreed? Vata is basically शीत, वात में शीत गुण भी है और रूक्ष भी है. Whereas कफ में भी शीत गुण भी है बट रूक्ष नहीं है. कफ में तो स्निग्ध है. मतलब दोनों में शीत गुण है. Both will have शीत gunas. What is the difference now? In Vata, the Shita is apatarpana Shita, whereas in Kapha, it is santarpana Shita. Okay, in case of Kapha, it is a santarpana Shita. That means that body Shita is a nourishing one, whereas the Shita which is present in Vata, so that is a denourishing one. Okay, apatarpana. Vataja Shita is seen in Varsha Ritu. Vataja Shita, if you want to experience Vataja Shita Lakshanas, so Shita Guna of the Vata, if you want to feel it, experience it, Varsha Ritu. Let's Kafaja Shita is seen in Hemanta Ritu. Okay, so Vata Shita is seen in Dhatu Kshaya, whereas Kafaja Shita is seen in case of Avarana. So this is how we have to clinically understand this. Okay, so next part, doshas and relation to the rasas, that is also very important. So that part we will going to discuss in the next class.